In the run-up to the election, we are giving you the chance to tell us what you would do if you were Prime Minister. All this week, we will be looking at the big issues facing the country and asking, what would you do? Love that. Massive thank you to our graphics department for that. When I say graphics department, I mean Jeremy. OK, we're kicking off today by asking, if you were Prime Minister, how would you fix the NHS? Do give us a call, 0207 862 2222, and we'll speak to you in just a moment. Now, a Channel 4 Dispatches investigation revealed nearly 19,000 NHS patients were left waiting for 3 days in A&E over a 12-month period. The investigation shows scenes from an A&E in the Royal Shrewsbury Hospital. My goodness. One patient was left for 30 hours in a fit-to-sit area, and a suspected stroke sufferer was left for 24 hours. It's not just A&E where there are issues. Staff have been embroiled in strike action over pay. Waiting lists are record high. Life expectancy is increasing, putting strain on services. And obesity is yet another issue. How would you tackle it, Kevin?
Yeah, 7.5 million on the waiting list, and 3 million of them have been waiting more than 18 weeks from your first appointment to your op. You're supposed to have it within 18 weeks. Look, you can have an efficiency drive, but there's no other alternative but to spend more, to train more doctors, nurses, other staff, improve the facilities and get more beds. And how would you fund that? Well, I'd abolish capital gains tax, merge it into income tax, and close loopholes, tax breaks for people on big, high salaries. But you can't get round investing more. It's a life or death service. It's absolutely crucial. Got to tackle social care too, and I think it is worth really having a big run at it and accepting you've got to spend, because we'll all benefit from it in the end. OK, raising more tax, putting more money in the NHS in order to get more staff, doctors and nurses. Yeah, you can't. Yeah, you can't do it without staff. Yeah.
Cristo, what would you do?
OK, so our spending on the NHS, based on the proportion of our GDP, I think in recent years it's been about 5th or 6th out of the OECD countries. I think that's actually jumped up since COVID. So our spending is really high in comparison to other countries when it comes to NHS care. I think that we need to start looking at efficiencies. I think that's a fair point. But also, we need to get rid of this sort of religious deity approach to the NHS and actually approach it as we do other services and as other countries do. So many other countries have looked at the NHS model and they've merged it, still at the point of use. And I think that's a really important point, that the NHS is free. However, they encourage people to take private healthcare, and they have a tax incentive for people to do that. But they also have, and we have some of this in the NHS when it comes to delivering services without patient choice, but patients, if they're having a surgery, you have hospitals in some Scandinavian countries, Australia I think is one of these places as well, that compete for that business. So it's funded by government, but the patient can choose, if they are going for a surgery, which hospital they go to. That has raised outcomes massively in those countries. Now, so if you compare our spending to our outcomes, our spending is high, our outcomes are absolutely diabolical when it comes to treatable illnesses. So what we need to do is get the spending up by giving that choice while still maintaining free at the point of use. You have it's called patient choice. It exists now. You can say, I want to go to that hospital. The problem is, if that hospital's got a long waiting list, you'll have to join it, because it's a system that's operating at capacity. That's why it is under such strain. The capacity isn't there. But that's why you have that choice now. You have that choice now. Certainly in England.
We're getting lots and lots of calls on this, so I just want to get to as many as possible. Dave from Manchester, what would you do to sort out our NHS?
Well, first off, I would settle the pay dispute with the doctors and the consultants.
And give them the 30 plus increase, 30% plus increase?
Yes, I would do that, because it's the only one. It's been going on for too long. Okay. I also would bring back the nurses' bursaries, and give them a decent pay.
Right.
I would sort out the chaos of NHS dentists, making certain that it's attractive to private dentists to accept NHS patients yet again. I would pay for it by slapping on a penny in income tax for salaries around about above £50,000 to £60,000, and also let's have a good hard look at all that British money from very rich private individuals living in this country and in British institutions that are washing about in offshore accounts.
So, Dave, just to confirm, you would increase dramatically junior doctors' pay, you would increase sort of the pay for nurses, and you would also increase the amount we pay for dental work to dentists to make it worth their while picking up NHS work, and you'd pay for all this by taxing the wealthy.
Yes.
Well, there you go. That sounds simple enough, Cristo.
And a penny on the basic rate of income tax. I think it's about I think it gets you about £7 to £8 billion. That Dave.
If Labour win the next election, then we are going to have the highest tax burden as things stand since 1948. We already give the NHS, in comparison to other countries, absolutely an astronomical amount of money. Something's wrong that our outcomes don't match the money we give it. So to then suggest, look, just way more money and way more of a tax burden on people, I think that we at some point have to ask some hard questions and look into the idea of the way other countries do it.
We already have the highest tax burden since the Second World War. If it goes up a bit, it depends who is paying. The tax burden itself, the overall tax take in the country, is about 36% of all income. It's in some ways it's a meaningless figure. It's who pays it. If you're on the average salary or less and you're paying more, that would be wrong. But if you've got a lot of dodgers and you're paying capital gains tax instead of income tax, which is a lot lower, I think that's a dodge and that should be closed.
Dave did mention offshore accounts and things like that. All the parties are attempting to sort out the NHS in sort of different ways, and we've seen that in their manifesto. So Labour, if they win in the election, wants to use the private sector to get those waiting lists down. Conservatives say that they will increase NHS spending above inflation every year. Liberal Democrats say that they would spend £1.1 billion on hospitals and on other NHS infrastructure and equipment. Reform UK want to give a private treatment voucher if you cannot see an NHS GP in 3 days, and the Green Party want to increase the NHS budget by £8 billion. What do you think about Reform's policy there, Kevin, of a private voucher?
Where are all these private doctors for you to go with for a start? You'll take money out of the NHS, you'll be putting into a private doctor, but where are they? They're just not there. There isn't the capacity there. During COVID,
which is why you want to increase the number of doctors.
Yeah, during COVID, private hospitals got a huge bung from the government to use their facilities. Very few were used. Private hospitals wouldn't have had patients during COVID. They stopped doing routine operations rather like the NHS did. They got a massive subsidy. It's the Labour programme. Let's pay for private medical care. Well, that's going to cost you. It'll probably in the long run cost you more than provided in the public sector.
Anne from Hertfordshire, what would you do to fix the NHS?
Yeah, hi, Storm, on panel. I would, the bosses that run all the different departments in the hospital, they, in my eyes, they get paid far too much. I'd cut their pay by 20% and give it to the nurses.
And what about the argument that those are very important jobs, and in order to fix a business
important jobs, but they're very overpaid.
But in order to fix a business that is failing, you're going to have the best people for the job. And if you're going to have the best people, you have to give them a competitive wage, because they'll just get paid more to go elsewhere.
They're just milking their positions.
But if they would get paid more elsewhere.
In the mess it's in.
Okay, but you're not listening. If they would get paid more elsewhere, why on earth would they go and work for the NHS? But then you're not going to get the best people for the job, Anne.
I don't care. I want people that are going to do the job for the love of the NHS.
And I get where you're coming from, because I share the sentiment in many ways. But the number of highly paid executives in the NHS is actually relatively small compared to what 500,000, 600,000 nurses. So they wouldn't, if you could take away all those 20%, it wouldn't go very far once you've spread it out. And secondly, Storm makes a point. Basically, salaries are driven by the private sector. And if you want a really efficient NHS, you have to have very good managers and executives. You may not like them, but you need them. And if you're going to cut their pay, they're going to go somewhere else, and then the service won't be run as well.
But Anne, you're not the first person to say that there's too many managers in the NHS, and maybe getting rid of a few of those positions that are may not necessarily necessary. I don't know, but thank you very much for your call. An interesting suggestion there. Pete from Lincolnshire, what's your thoughts on the NHS and how do you solve it?
Hello, team. Simple. Give free NHS treatment if you have a British national insurance number. Anybody else pay? Because if you haven't, one person per day per hospital in UK for a broken arm is about £5,000.
Okay.
Multiplied by 365 days is 1.5 billion.
So who are we trying to avoid giving access to the NHS then? Who?
Nobody. No, nobody. Give the free NHS to the person who has a British national
so,
insurance
Pete, does that
number.
mean if you're on here on a student visa, if you're over here on a student visa or a working visa, presumably you wouldn't have a national insurance number? I'm not entirely sure.
Well, I'm very sorry, but if my children go to France or America or whatever, they don't get free health treatment. I've still got to pay an insurance for them. So why can they, when they come over here on a visa, not do the same?
Pete, they don't automatically qualify. You may say the checks are not done, but they don't automatically qualify. You've got to pay. And you've got to pay in advance. I'm sorry, you might...
just talked about students.
No, I'm talking about everybody. You can't just turn up. No, I'm sorry. I think you've had your mind twisted by people with anti-migrant propaganda.
Pete, thank you very much for your call. Lynn from Glasgow, what's your view when it comes to the NHS and how you solve it?
Morning, Storm and team. The first thing I would do is set up a national care service. I would take all the social care and make it a central thing so that councils aren't doing different things all over the country.
Okay.
I would then put a consultation out to all frontline staff about what savings they can see could be made and what wastage they see on the wards and on the day-to-day clinics. And I would also take the nurses having to go to university. I would take that away and go back to the way it used to be where matrons and nurses were learning on the wards.
On the job. I've got you, Lynn. I thought for a minute there you were just like, oh, well, we'll just give them the job and see how they do. But I totally appreciate what you're suggesting. Now, all of those things sound lovely and I'm sure would be much appreciated. It does sound costly, particularly social care, and trying to get that to a standard where we would all be happy with it. How are you going to pay for that? Where is that money coming from?
If you've got an elderly person in a bed in a hospital that doesn't need to be there medically, that can't get out because the social care's not there, they're actually costing the country more money for that elderly person being in that bed.
So you would take it from the savings? Interesting.
It's looking at the whole, it's taking a step back, looking at the whole thing holistically and saying, right, well, we've got problems at the bed block, we can't get people out the back door to allow people in the front door.
Lynn, thank you for your call.
And the only way you're getting them out the back door is by social care.
Lynn, thank you. Ruth from Devon, what's your view on the NHS? What's the biggest problem and how would you solve it?
Well, I think the biggest problem is that finances are being distributed into totally the wrong places. We're talking about finances this morning. I think as much as possible should be thrown at the Cinderella of the NHS, the psychiatric and emotional support services. I think that physical health emanates from those services, and that has been totally disregarded. And I really think that everything should be thrown at those services to get people up on their feet. And
when you say everything should be thrown at it, we're talking about cash here. Where's that coming from?
Well, I mean, we all pay taxes, and they do put something into the NHS, but they put it into all the wrong places. Well, no, they do put it into places where they consider things are needed. But
where are you taking it? Are you taking it from A&E? We've already heard that people are waiting 3 days.
No, A&E is very important, and the waiting lists are terrible.
Cancer?
No, but I mean, people are paying their taxes. They ought to be. I don't know where they're going to take it from.
And this
I
is
mean,
the problem.
maybe they would have to put taxes up for people who are better off. I don't know.
Tax the wealthy. Ruth, thank you very much for your call. More money for mental health services. Darren from Cambridgeshire, the NHS, how do you solve the issue?
I'm coming at it from like a training perspective as well, like investing in young people's future, motivating them to go and work for the NHS. So a bit more of a proactive approach rather than a reactive approach. You could be going into the schools and saying, look, if you want to work in the NHS, we will pay for most of your training. We will subsidise it for you. If you want to be a nurse, do you want to be a GP?
Darren,
because we're dreadfully short of people like that at the moment.
Yeah, there might also be, you might have hit the nail on something here, that actually our attitude towards doctors and nurses in society seemed to have changed. You know, doctors were considered the backbone of society. They were very well respected. It was an incredible thing if your son or daughter went to study medicine and became a doctor. And I don't know if we feel that way anymore, Cristo. I mean, you hear time and time again stories about people attacking doctors and nurses in our hospitals. It's quite appalling.
I agree with that, and I think that we have lost a level of respect, and I think that Darren, and I think one of your previous callers made a really great point. It's absolutely staggering to me that we have a shortage of doctors and nurses, yet we do everything that we can to disincentivise them going and training by making it so unbearably costly. And fine, if we're going to have tuition fees for courses, I absolutely understand that, but where we need skills, every year the government should be saying, right, these are where we need people, this is where we will give you scholarships. There'll be engineering, whether it be doctors, whether it be nurses. I would also, by the way, have a different tax rate for low-paid public service workers like nurses. So again, rather than having to throw money at nurses, what you actually do is you have them keep more of their own pay packet, and that solves some of that problem.
I think the other issue is a lot of our trained doctors that we train in this country and nurses are leaving to go abroad because they're getting better deals elsewhere. So there might be a case of saying, OK, we're going to train you up for free, but you're going to have to work at the NHS for 5 years, Kevin?
I think it would be acceptable if the training was free. Look, it was once. Doctors didn't pay for their training because you didn't pay for university fees. Nurses trained largely on the job, some in the classroom. Now it's a degree qualification. Now, that's fine. You can have their training equivalent. But it was George Osborne who was a Chancellor in the 2010, 2011. He abolished nursing bursaries, and all of a sudden they were having to pay a lot. And we're now paying the cost of that down the line. It was a false economy at the time.
Roy from Wolverhampton, how would you solve the NHS? I would say issue, but it's issues, I suppose.
Well, I'm 80 and I'm quite willing to pay more money towards the National Health as long as that's where it's going.
Because wasn't that supposed to be what our national insurance was? I mean, I think it's quite hard to ring fence things. Is that not true?
Yeah, national insurance is also for your pension, and if you're unemployed rather than the
maternity leave and things.
Rather than the health service,
So it wasn't necessarily the health service. So you would like a sort of national insurance-esque task that could be ring fenced, so we know that that money is going into our health service.
Yes.
Okay.
The private medicine it costs them an NHS a fortune. When they send somebody to a private hospital, they have to pay.
Yeah.
And they sent me for a hip replacement, and they were all up to doing it. And then they said that your blood sugars are too high. I went to a military
hospital.
He X-rayed me, and he said, "I don't really think you need hip replacements." He said, "We're going to try the injections first." So, were the private hospital doing the operation for the money or for me?
Oh, I can't answer that question, Roy, but thank you very much for sharing your story. Gary from Liverpool, the NHS, how do you solve the issues that it has?
Well, for a start, I think you've got to tax the rich.
More.
14 years of Tory government has just ruined the NHS. Half it's privatised. It needs to go back into public hands.
I can't remember the exact stat, Gary, but the top 1% earners in this country pay a substantial amount of the money raised. I think it's 60%. Kevin's going to correct me. I can already see him going with the Hawkeyes.
I think the figure cited as 28% of income tax, I think, isn't it?
It's quite a large percentage already, Gary, but you would make sure that they were taxed even more.
Yeah, I would, to be honest. And also, the nurses are paying for car parking and paying for their own dinners, doing 12-hour
Interesting.
shifts.
So there's other things that we could do to look after our doctors and nurses, and not just doctors and nurses, the cleaning staff, all the staff in the NHS that make it tick over and help us with our health. Gary, thank you very much for your call. Thanks for all your calls on that.